to Body Beautiful. Right now we're talking with Dr. Elizabeth Lee about mommy makeovers, and any kind of plastic surgery questions you have, you can certainly call in. The phone number 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want to consult your own physician as well. You know, we're talking about some of the, you go to the grocery store and you see the magazine covers and all these, babies are in, and all these new mommies, Hollywood mommies, and Sarah Jessica Parker, example.
When a couple of months after having her child several years ago now, she was on the cover, I believe, of Vanity Fair with the six-pack abs and the whole thing. And in the article, though, she said, I'm really uncomfortable doing this story because this is my job to look this way, and I have all sorts of help to do it. The average woman having a baby should not be aspiring to look like this. It's not really possible. You have a child, you might have a job, and most people don't have the services that I have to try to get back into shape.
So how much time should we wait? Let's say after you've had the child, your body will naturally kind of get back to its shape. How long does that take?
Well, if it's going to happen, I generally tell patients to wait about a year before they can sit. Yes, unless their children were several years apart and they know they never bounce back after the first one or the second one, and this is now the third. Because what I like to tell people, particularly women who are really anxious about this, is that you didn't get in that shape overnight. It took 9 months, and that it's really important to set your goals appropriately. I don't encourage women to try to expect to get back into the jeans that they wore before they were pregnant. Everything has changed. But it's okay if you went from a size 6 to a size 8 jeans and your body weight is appropriate. It's all right to wear size 8s. You don't have to have that goal of, I got to get back into my pre-pregnancy jeans.
So for those people that are exercise fanatics, the day after they have the child, they're out there doing sit-ups, and
sometimes
advisable or not?
Well, sometimes it's not. And the thing to understand too is that if you have a true, what we call rectus diastasis, which is a separation of the midline abdominal wall muscles, actually doing exercises can make that diastasis worse. And so it's really important that patients are appropriately advised by their trainers, excuse me, and also that if you have questions, that you go and see a plastic surgeon, because they can give you advice on what to expect as time goes on and when you could plan to have something done.
You brought some photographs. Let's go ahead and roll those so we get an idea of what we're talking about here.
Okay, so this is a patient who had 2 babies, and on the left, and on the upper photographs are the preoperative pictures, and the lower are the postoperative. And what you see on the left is that she has a separation of her muscles, and the bottom pictures show her after she's had a full tummy tuck procedure with removal of some skin and tightening of the muscles.
Six-pack abs.
Well, she's looking pretty good. And on the right, she lost volume in the upper pole of her breasts. Her nipples were not very low, so she did not have true breast drooping, but she didn't like the way her breasts look, and she underwent an augmentation.
Okay, so is that from nursing?
It's from nursing. It's from the change that occurs just during pregnancy. Most women's breasts enlarge and then they get smaller, and it's a very common post-nursing finding to have what we call pseudotosis, which means that the breast looks droopy, but if you look at the position of the nipple relative to the crease underneath the breast, the nipple's in good position. The nipple itself is not low, but the upper portion of the breast has hollowed out and it makes the breast look droopy.
A friend of mine just had a breast augmentation a few years back, and she was complaining after 2 kids. She said, my breast looked like a rock in a sock. I mean, what happened?
That's our description of it. Right, and what happens is that the breast tissue enlarges to make milk, and then it shrinks again, and the skin doesn't always bounce back, and things shift around.
Okay, do we have another picture that we want to roll here, or was that it? Oh, there we go.
And here's another patient who also postpartum, and on the left she's had a tummy tuck, and on the right she's had only a breast lift. So she liked the volume of her breasts, she just didn't like the shape of them, and so we were able to do a lift procedure or a mastopexy only. There's no implant in there.
Okay, so not all mommy makeovers are the same. You really just look at what's happened to the body.
And also what the patient wants. I mean, sometimes patients say, I really liked the size of my breasts when I was nursing, and now they've gone gone back down to smaller than they were pre-pregnancy. And not only are they drooping, but I want them to be fuller again, because I like being full.
Okay.
And sometimes we have patients who say, you know what, they were always too big, now they're too big and I don't like the shape.
Okay, really quickly, we're running out of time, we're going to take a break, but we've got one more picture here.
And here's another patient who had a tummy tuck and had a I love the artful, uneven placement of the nipple guards there, but
it's a family show.
Yeah, but she had a breast reduction, so you know it's hard to tell with those markers. But those breasts were really quite large, and we're pulling on her. And she said, "You know what? I'm done nursing. I'm done having my babies. Now these are mine. I want them to be what I want them to be, smaller."
All right, we have several calls coming in. We need to take a quick break, but for more information about Dr. Lee, you can call her 510-704-2170 or visit her at our website at artfulsurgery.com. When we come back on Body Beautiful, we'll continue our chat about mommy makeovers and we'll be taking your phone calls.